Fire broke out at the FH Odendaal Hospital in Limpopo. The blaze apparently started in the COVID-19 ward. Health MEC in the province, Dr Phopi Ramathuba, is there. Let's find out from her what she's seen. MEC, good morning. Thanks so much for your time. A busy morning indeed for you. What have you found at the hospital when you got there?
Good morning, and morning to your viewers out there. What I found, of course, is a devastating situation where one of our cubicles in our COVID-19 ward was burned down completely. What I must indicate is that we did have quite a number of patients. Many of the other patients were admitted in other cubicles where patients under investigations for COVID-19. The nurses, I must indicate, did their level best because they've been able to evacuate all those patients who were admitted, even in the other close-by ward, wherein they've been also at the same time be the ones who did stop the fire before even the fire brigades arrived. Unfortunately, even though they tried to evacuate all the patients, there are two patients who demised. One was a very critically ill patient who was admitted being semi-conscious already. Patient arrived late, probably last night, and they were trying to stabilize so that in case they could refer. So that's the patient who demised. Another patient was also an inmate who was also very, very ill. So it's quite sad that, yes, while we have tried to rescue and save all the other patients, these two, we could not be able to save their life. And we want to send our sincere condolences and deepest condolences to their families. We have already dispatched the team to go and convey our message now on behalf of all of us to inform the family what has really happened.
MEC, just clarify for us the deaths of these two patients. Were they directly related to the fire? I know you say that they came in and they were quite ill already. Is it because they couldn't be saved? Were they caught in the fire? Just the cause of death there.
We would want to allow the autopsy to be done and the postmortem to give us results, because at the same time we could say smoke inhalation might have worsened the situation where you find someone very critically ill and then the person inhale the smoke. This is a COVID patient who already in respiratory distress and was caught in fire and inhaled the smoke. That could have contributed the fact that they were very sick, and also the fact that they have inhaled the smoke during the process. That both. But I would want to allow the team that is already on the site. The pathologists have already collected the bodies. There will be. I was talking to him. He will be starting with the postmortems as soon as possible after all the families would have been informed, and they will be able to give us the report what happened. And also there are investigators in terms of fire. When I spoke to them, they were leaving Pretoria. They will be arriving here soon so that they can investigate the cause of fire. But the current team that I'm with on the site, they've taken me through the scene, and they have already indicated to say, from the look of things, the fire was not probably as a result of structurally damage, but we will have to wait for that report. And also the fact that the fire has started inside the ward. So there are many other speculations from other patients, which we would want to not to cause a lot of alarm and allow the investigation, so that once they give me exact report, if it did correlate with what the other patients have told me, we will then be able to take it from there. But as it is for now, we wanted to focus on the bereaved family. And also our staff, that they are being debriefed as we speak. Also, those who were extinguishing the fire, they've already also, they themselves inhaled the smoke. But I'm really comforted by the fact that we have not lost any of them. They themselves have been, their systems, which those fire extinguishers that they have were able to work. That's why they were able to contain the fire before even fire brigades arrived.
All right. MEC, are you able to tell us just the extent of the damage at the moment, and what will you be doing with the other patients who were in that ward? Where would you be able to place them now, seeing, as you say, there were potential or possibly COVID patients that investigations or their diagnosis was yet to be revealed?
The advantage of where we are now is that 8 kilometers from here, you remember we have one of the state-of-the-art facilities, which is the COVID-19 center. We have already evacuated all the other patients to Modimole, our multiple drug resistant TB hospital, which we converted to deal with COVID-19. We have already evacuated those. There are other patients in the ward which is close by, the female patients, and also all the neonates and all the babies, because we are just worried that if oxygen supply is affected because of the fire, we have already evacuated them. They are Bila Hospital, which is there in Bila. It's just 27 kilometers from here. So all our patients are in safe hands. I've just checked with the 2 CEOs of those facilities. The patients are fine. They are doing well in those facilities.
All right, MEC, we'll let you go now. That's all we have time for at the moment. Thanks very much for that. That's Health MEC Phopi Ramathuba there in Limpopo. And the tragic news coming through of the loss of 2 patients in that fire. Investigations still continuing into the cause of that fire as well. But for now, they have moved other patients out of that ward to other facilities, as you heard the MEC say. We'll continue to keep an eye on that story.